Good evening, ladies and gentlemen, and thank you so much for coming. I remain my humble self, Lucky, aka also known as Dr. Drugs, and today we'll be talking about something that affects a large group of, or a large portion of our population, and that is arthritis. But we're not going to go so deep into each and every one of them, but we shall go deep enough to be able to understand how these things can be managed and treated. We'll talk about osteoarthritis, talk about rheumatoid arthritis or rheumatism, and then we'll talk about gouty arthritis. So this is the flyer that most of us got, talking about arthritis, osteoarthritis, rheumatism, and gout, management and treatment. I remain my humble self, Dr. Drugs. And here is our table of contents. We can't talk about arthritis without talking about the human bones and joints. And we can't talk about arthritis without defining it. Its types, signs and symptoms, causes and risk factors, complication, diagnosis, and more. The human bone structure is the internal support framework of the body and is made up of bones connected as joints. Now, a baby is born with 270 bones, which decreases to 206 as we become adults. Isn't God so wonderful? And the total weight of bones in our bodies, about 14% of our total body weight. They're composed of calcium, let's bear this in mind, chondroitin sulfate, and some other elements like phosphorus. So what are joints? These are connections between bones that link the human skeletal system into a functional whole. Now, we have hinge joints, ball and socket joints, fibrous and suture joints, etc., etc. But the components at these joints are often similar. Now we have cartilage that act as paddings between these joints to prevent bones from rubbing against each other. These are smooth connective tissue made of cells called chondrocytes. A lot of us are familiar with the word chondroitin and glucosamine because it's written in so many supplements and products that have to do with arthritis. And of course, these chondrocytes produce a large amount of collagenous matrix. This collagenous matrix, what I call the swimming pool of the chondrocytes, contain collagen, elastin, glycosaminoglycans, and all that. Maintaining the integrity of this swimming pool or extracellular matrix is essential to ensure that the bones are adequately padded. So they protect the ends of long bones, and we have hyaline cartilage, which act as padding between joints, like in between the spine and the supporting muscles. Okay? Tendons and ligaments, they act like bushings in calves. Sometimes they even form a major part of organs in the ear, as we have the elastic cartilage, and then hyaline cartilage, which contains hyaluronic acid. Please let's bear in mind this biomolecule. Then we have cartilage, which often lack blood and nerve supply. Now, this cartilage often lack blood and nerve supply, hence they heal slowly, and it takes time to produce collagenous extracellular matrix. That's why when a patient is searching for a quick fix, you end up having something that will lead to a recurrence of the situation because it's not magic. These things heal very slowly. They don't have blood supply, so they just basically get things as slowly as possible and enhance their structural integrity. Okay. Now they function as paddings like shock absorber, connect muscle, tendons, and ligaments in the body's structural support, and guess what? Reduce friction between bones. Let's bear this in mind because we're going to talk about it shortly. So you can see what they look like. You see this lovely blue here, where we have this cartilage preventing these two bones from rubbing against each other in the knee. It's just a microscopic view of what these chondrocytes look like, and based on different types of cartilage that they are being viewed from. So let's get down to business. What is arthritis? It is defined as painful inflammatory disorder and or stiffness of the joints. It's coming from Greek literature, meaning disease of the joint. Some are also known as rheumatoid diseases, actually. Let's bear this in mind that rheumatism often refers to a form of arthritis called rheumatoid arthritis. We'll talk about all this shortly, more like an intro. So let's start with osteoarthritis. We have over 100 types of arthritis, but the most common is osteoarthritis. This is the most common form of arthritis, also known as degenerative joint disease, and often affects the fingers, wrist, elbow, feet, knee, shoulder, hips, and back. But that spine. We spoke about spondylosis, as well as sciatica. This can be found on Dr. Drug's channel on YouTube. You can watch. Then it often occurs with aging. That means it is age-related because it is degenerative. As people get older, they tend to have this condition. So it often begins with the breakdown of joint cartilage and proceeds into the two opposing bones or eroding each other at the joint. Now, it commences with little pain during the physical activity and graduates to pain even while at rest. Unlike rheumatoid arthritis, it's often associated with the elderly. Its cause is basically mechanical with little inflammatory influence. That's how we differentiate between these types. We'll talk more about this shortly. Now, it is more pronounced at weight-bearing joints, of course, because of the mechanical aspect to its the way it happens. And then, of course, back, the waist, the knee, and doesn't affect internal organs unlike other types like rheumatoid arthritis. This is an example of what we're talking about. We spoke about this not too long ago when we're talking about sciatica, as well as when we're talking about spondylosis. You can see a lovely section of the spine with beautiful paddings or cartilage preventing the bones from moving against each other. But let's look at this one on the right here, and can you imagine the kind of pain this person will be undergoing? And imagine the stiffness the person will be undergoing. The person can't bend down or carry out daily activities the way they ought to. Beautiful. Now, this is exactly what happens in the knee when one is having osteoarthritis. Look at this beautiful padding here at the end of the long bone. You see how healthy and shiny it is and smooth, preventing these two bones from rubbing against each other. But on the right here, unfortunately, this person is having degenerative joint disease, osteoarthritis. And you can see these are the things that make that crackling sound called crepitus. We'll talk about that shortly. When people walk and cause excruciating pain because of the direct contact between the two bones at the joint, and a lot of other issues that we're going to talk about shortly. Now, rheumatoid arthritis, aka rheumatism. In fact, some people call all forms of arthritis rheumatism. They are different. Rheumatoid arthritis is an autoimmune disorder. That means for an unknown reason, the body wrongly attacks itself. That often affects the joints of the fingers, the wrists, shoulder, knees, elbows, and even involves attack of the joint lining. Look at this picture over here. You see that the lining of this knee joint is well encapsulated with the synovial membrane intact. But if you look at the one below, you see that rheumatoid arthritis has begun to show this part, another side of life that's begun to destroy this joint, starting from the synovial membrane and causing also all forms of inflammatory issues, because the white blood cells cannot differentiate between the joint tissue that belong to their owner, and they begin to attack it wrongly, and that is the origin of this condition. That means it's an autoimmune condition. We'll talk about one or two other autoimmune conditions shortly. So that's why it's important to bear this in mind, and we'll talk about how we can differentiate between rheumatoid arthritis and osteoarthritis and gouty arthritis. So let's stay tuned. Now, you see, it involves attack of the joint lining or synovial membrane and cartilage, and this eventually leads to the erosion of the two opposing bones and the affected joint. You see that it graduates into osteoarthritis one way or the other. It also affects other organs of the body like the lungs, the eyes, the heart, skin, nerves, and blood. A lot of people do not even know that this causes anemia and can actually cause rheumatoid heart disease. And it can also lead to dry eyes, especially when the white blood cells begin to attack the fluid-producing cells in the eyes. We'll talk about that shortly, and a lot of other issues that we will talk about shortly as well. Now, gouty arthritis. Well, people will say this is a big man's arthritis because the things that lead to this arthritis are often found in abundance in the homes of the wealthy. So it's a type of arthritis that causes inflammation of the joints as a result of deposition of crystals, uric acid crystals, and the joints. It often attacks the great toe. Yes, it often attacks the great toe, ankle, knees, and elbows. Its attacks are often at night. So you can see one way we can differentiate this or begin to suspect whether this is gouty arthritis. And it was popularly known as a king's disease, as I've mentioned, as only the wealthy could indulge in its major risk factors, which include wine and red. You can see how terribly swollen this big toe is over here. You can see that. Then you can see the position of uric acid crystals. Look at how they deposit at the joint there. Look at how sharp they are. These are like needles. Imagine tiny needles, in uncountable tiny needles pricking you at the joint there. So the pain is often terrible and debilitating. Well, for the interest of one or two people that have asked me about this condition, because we talked about spondylosis. Now, ankylosing spondylitis. Let's bear in mind that the word ankylosing is synonymous to fusing. Now, it's a form of rheumatoid arthritis of the spine, a chronic inflammatory disease that primarily affects the spine and the sacroiliac joints at the hips. Now, it causes inflammation and stiffness in the spine, leading to fusion of the vertebrae, aka ankylosis. Now, it typically affects people between the age of 15 and 30, unlike degenerative joint disease that has a higher propensity as people get older. The symptoms include back pain and stiffness, limited mobility and flexibility, inflammation and pain in other joints, fatigue, eye inflammation, etc. It's closely related to what? Rheumatoid arthritis, but has no rheumatoid factor. We'll talk about what rheumatoid factor is shortly. We'll know why I ask people to go and run blood uric acid level test as well as rheumatoid factor when they come with an unknown type of osteoarthritis. You can see this man here is in terrible pains, obviously, and you see how his back is bent, can't stand straight because of the fusion as a result of the ankylosing spondylitis. Then, just briefly, we've talked about this before. It's also on YouTube, on Dr. Jog's YouTube channel. Spondylosis is simply osteoarthritis of the spine, and it's a general term for wear and tear of the spine, often caused by aging or degenerative changes. It can also refer to various conditions such as degenerative disc disease or spinal stenosis or stricture, where the spinal cord is squished as a result of factors that occur due to DDD. Now, it typically affects people above the age of 40, and its symptoms include back pain, stiffness, limited mobility, and may lead to lumbar disc herniation and sciatica. We spoke about sciatica already. You can find it on Dr. Jog's YouTube channel. You can watch about later to be there, and then you have a clearer picture of what sciatica is and how DDD gets to sciatica. Now, we have infectious or septic arthritis. It occurs as a result of infections at the joint. Then we have reactive arthritis, and it occurs as a result of infection in other parts of the body. This is a very funny kind of arthritis because it's causing problem that does not concern it. You know, imagine having an infection somewhere and a matter that does not concern it is having a repercussion on that side. And that is why it's called reactive arthritis. Then we have another type of issue. I won't say arthritis per se because it has a lot of issues attached to it, amongst which arthritis is one of them. And we have systemic lupus erythematosus, SLE. Now, it's simply autoimmune attack of various healthy tissue of the body, and we'll talk about that in a little more detail shortly. So just because one or two people asked for this, I just want to run through this briefly, and then we can have an idea what it is. It's a topic for another day, and you see that systemic lupus erythematosus is a chronic immune condition or disease that can affect various body parts, including the joints, the skin, kidneys, brain and nervous system, like in neuropsychiatric lupus. Then we have blood cells, anemia, but low white blood cell count, heart and lungs issues. It's quite similar to what we experience in rheumatoid arthritis, but it is even worse. You can see the butterfly-shaped lesion on this skin is one of the ways you can actually just have a spot diagnosis of if someone is lupus, but of course, not without proper diagnosis and other things. In systemic lupus erythematosus, the immune system mistakenly attacks healthy tissue. You remember what happens in rheumatoid arthritis, causing inflammation and damage. Now, it is a complex condition with a wide range of symptoms, and each person's experience can vary greatly from each other. Common symptoms include joint pain and swelling, fatigue, and fever, aka arthritis. Then skin rashes, the butterfly-shaped rash on the face as depicted here, and of course hair loss, mouth sores, photosensitivity, then kidney problems. Anyway, the kidney is also an organ. It can be attacked as well. So SLE is diagnosed through a combination of medical history, physical examination, laboratory tests like blood work, urinalysis, imaging studies like X-ray and CT scans. Treatment aims to manage symptoms, prevent flares, and minimize organ damage. That is basically what it is. Treatment is focusing on the comorbidities and addressing the comorbidities that are associated with this. Now, so its medications include immunosuppressants, corticosteroids, and all that and more. There's lifestyle modification includes sun protection, stress management. Of course, we know that stress leads to the production of cortisol. That is a stress hormone and leads to a myriad of issues in the body. Then regular monitoring and follow-up of appointments. That is also very important. Of course, early diagnosis, because a stitch in time saves life. All these will help to improve the quality of life of the patient and manage the condition. Pain is a general symptom of all arthritis, but may include swelling, reddening, aching, and or stiffness around the joint. Now, it may affect other parts of the body, as in rheumatoid arthritis and lupus, and may also include general discomfort, uneasiness, and pain, fatigue, weight loss, insomnia, and low blood. Now, the anemia part is mostly as a result of the autoimmune, the arthritis that is caused by autoimmune conditions, like the rheumatoid arthritis, the SLE, and all that. So more specifically, this bone here is not a model, but it's giving us an idea of what is going on. You can see that over time, it is getting structurally destroyed. You can see the gearworks here eroding the bone, and you can see the clock. That simply basically tells us that this is osteoarthritis, or the bone is modeling for osteoarthritis. More specifically, osteoarthritis has these symptoms: pain and stiffness that is worse in the morning, eases quickly with movement and exercise, and it often affects one side more than the other, unlike rheumatoid arthritis that affects both sides. Then it gets worse with activity again. After daily activity at the end of the day, it also still gets worse. So it causes decreased range of movement. That's one of the symptoms. Crepitus is the crackling sound you hear on some people's knee when they walk. Yeah, crack, 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 crack. Remember the picture I showed us where we saw the healthy knee and then we saw the unhealthy or the osteoarthritis damaged knee. And you can see how rough it was. And those things are what makes the sound called crepitus. Joint locking is another problem. The ability to bend the joint at a point in time becomes so stiff. And instability may also be present because the person may lose balance and all that. Sometimes the knee begins to bend to one side when the person is like, instead of forming it like a bow leg, showing that, in fact, instead of it to be straight, it now forms something like this. That is a very terrible thing that happens because it can break off. Now, unlike other types of arthritis, the joints are not red or hot, and its symptoms progress over the years because it degenerates. So if you don't do something about it, it's going to get worse and worse over time. Then we have rheumatoid arthritis, which is characterized by pain in multiple joints, generally worse in the morning or after prolonged activity. Let's take note of that. Warmth, stiffness, swelling, reddening at the joints, fever, skin rash, often symmetrical. That means when it's happening on the left side, it's happening to the same part on the right side. Let's take note of that. And then morning stiffness that lasts for more than 30 minutes, loss of appetite, numbness or tingling in the hands or feet because of a condition we're going to talk about shortly, difficulty performing daily activities, joint deformity and disfigurement. Look at somebody's hand, for the love of God. Rheumatoid arthritis has destroyed this person's hand, and we'll still talk about other factors or things that are surrounding this picture we're looking at. Now, gouty arthritis, you see, it has a very sudden and severe non-symmetrical joint pain, very severe, and often in the big toe, swelling, redness, and warmth in the affected joint, tenderness to touch, and limited mobility or stiffness, because, of course, who want to flex a joint that is swollen and tender? Then there's fever or chills, nausea, vomiting, recurring episodes of pain and inflammation. Sometimes you feel as if it has gone. All of a sudden, boom, it comes back again. Then we have what are called tophi. These are small, painless lumps under the skin. And of course, there's a very terrible complication that is called kidney stones. These are often as a result of uric acid deposits in the kidney. Look at this man's picture here. You can see him holding his toe and crying out in pain because of the terrible condition caused by gouty arthritis. Now, what are the causes and risk factors? Generally, any factor that affects the structural integrity of the joints and bones may lead towards arthritis. But specifically, for osteoarthritis, we have aging, talked about that before, trauma or injury, genetics, because if both parents have had osteoarthritis before, it's possible that the child will most likely have it. Obesity, because of the weight that is bearing on the weight-bearing joints, especially the knee. And in fact, once a patient comes and is having osteoarthritis and the patient is having a high BMI, there is no need giving the patient any remedy at that point in time, except temporary remedy, because once you are done, the weight is going to still squish on the joint and damage it again. So the first thing to do is to tackle that obesity. Reduce the BMI to 18.5 to 24.9 kilograms per meter square, and the patient will begin to have a miraculous recovery. This is how I handle my cases, and I'm having good results by the grace of God. Female gender, of course, we know that the female sex hormone estrogen is osteoprotective. So you can see that once women begin to move towards or around menopause, this osteo or bone protective quality of estrogen begins to get diminished, exposing these women's joints to osteoarthritis. Lack of exercise. Some people will start exercising after the osteoarthritis has come in place. That is contraindicatory. Exercise regularly before it comes, and you do appropriate exercise. Diabetes is a disease of diseases. It is a general destroyer of everything in the system, starting from damage of DNA of the cells in the joint to excess sugar destroying the collagen that is found in the cartilage or cartilage in the joint, and a lot of other issues. It can even predispose the joint to infection and lead to infectious arthritis. And of course, jobs with high joint stress, that is having excess load or strain on the joint, loss of muscle strength, supporting the joints, because the muscles also help to support these joints. But when they are weak, it can lead to all the work being on the joint and leading to osteoarthritis. Then, of course, nerve damage and paralysis, which can lead to what I call the use-disuse theory, because anything that you don't use in your body begins to wither. Then we have rheumatoid arthritis. The causes are generally unknown, but the risk factors are influenced by what? Genetic and environmental factors like smoking, vitamin D deficiency. Who knew this? So you see, when a patient comes to me and having rheumatoid arthritis, I make sure that this patient gets a high dose of vitamin D, just to be sure. And then previous joint injury, because if the joint had had an injury before, the white blood cells may begin to attack maybe the tiny fractions as a result of that injury. And in future, those white blood cells can come back and begin to attack the healthy ones that are still intact as well. That is the origin of this previous joint injury as a risk factor. Obesity, of course, we know can lead to a myriad of things, because it's a lifestyle disease, and it's one of the chief lifestyle diseases because it is connected to a lot of other lifestyle diseases, including type 2 diabetes. Now, gouty arthritis, the risk factors include smoking, overweight, and purine-rich foods, like people that like to eat Sebastian. Look at Sebastian here. You want to eat Sebastian Little Mermaid all the time. Bear in mind that Sebastian contains purine, a lot of purine, and those things will lead to uric acid production. Also, organ meat and all that. You see, the sweetened beverages like the ones that have high fructose corn syrup and beer intake, as well as genetics. Look at this young man. He has been drinking to the extent that he's now living inside the bottle. And how does he expect that he's going to solve this problem that has to do with gouty arthritis? Of course, infectious or septic arthritis is as a result of infections. So how do we diagnose these issues? Medical history and physical examination. You can imagine someone that is limping and crying and shouting, and that is already a red flag. And then we have X-ray to assess damage, joint damage and bone spurs. Then we have MRI and CT scan, which is similar to what X-rays do, but in more detail. Then the joint fluid analysis is to rule out other conditions like uric acid crystal deposit as a result of gouty arthritis and other issues. But I would have preferred measuring the quantity of uric acid in the blood, and that is usually better, but sometimes we need to do this. Then blood tests to rule out other conditions, because you know that the rheumatoid factor can be detected via in the blood and all that. So then we have for rheumatoid arthritis, the medical history and physical examination, blood test, rheumatoid factor. Then we have the anti-citrullinated protein antibody as anti-CCP. Then we have the erythrocyte sedimentation rates, ESR, because the ESR and C-reactive protein are very good biomarkers for what? Inflammation in the system. You see, God is very wonderful. Once something is going wrong in the body, that part begins to oftentimes send signals into the blood that can be detected. A typical example is when people are having myocardial infarction. You see that cardiac enzymes like troponin 1 and 2, myoglobin, and creatine phosphokinase begin to appear in the blood. That tells us a lot already. And then we have imaging tests, X-rays to assess joint damage and deformity, ultrasound to evaluate joint inflammation, MRI to evaluate joint damage and inflammation as well. Very simple. Now, for gouty arthritis, we need a medical history and physical examination. Now, uric acid level test. Blood uric acid level test is very important. Then erythrocyte sedimentation rate and C-reactive protein to assess inflammation. Of course, we talked about that before. Joint fluid analysis to detect uric acid crystals because they can deposit there. Of course, imaging techniques like X-ray, ultrasound, and dual energy CT scan. So what are the complications? Chronic pain and immobility. Destruction of the connective tissue that attach muscles to the bone and hold the joint together. Poverty and economic challenges. Remember that without your legs or your joints, you cannot walk. One cannot work without these things and earn money. Of course, organ damage and failure, as in the case of rheumatoid arthritis that damages the heart, that damages the eyes, kidneys, lungs, and a lot of other issues. Skin, and even causes anemia. You can see that. Lack of sleep, because who can sleep with pain? Sciatica, this is when it happens, especially in the lumbar region. This is when we have lumbar disc herniation or other degenerative disc disease, or we have spondylosis that can lead to degenerative disc disease, lumbar disc herniation that eventually squishes the sciatic nerve as a result of the herniated disc. Then we have peptic ulcer disease due to the analgesics people consume. These analgesics do next to nothing because all they do is give temporary relief that will make the person even lean more on the place, because pain is actually an alarm system created by God to tell us that there's something going on somewhere, so we don't lean on it. When we take analgesics, it denies you of that sensation to pain, and people begin to dance makosa when they're having issues. When the analgesic wears off after its half-life, based on its half-life, then go back to square one. By then, we have ground the joint even more, and the pain would have gone higher. Bear in mind that painkillers are killers, but nobody will advertise a drug for pain relief and advertise the side effect as well. So we have to apply wisdom. Now we have depression and suicidal tendency. Imagine a soldier, a general in the army that used to lead people to war, cannot even walk. And he is kept on one side, and his juniors are just taking charge of all the things he used to do before. And then at the point in time, they're even saying, I think it's time for retirement. And this is something he loves doing because of arthritis. You can see the person may begin to get depressed. And what follows depression is what? Suicidal tendencies. Paralysis, of course, especially in cases like when we have sciatica, and of course, death, because rheumatoid arthritis kills completely, and so on and so forth. So, what are the challenges in the management of arthritis? Because a lot of people want to manage this condition, but we have issues or things that hinder the process of management of arthritis. Delayed diagnosis is one of them. Poor compliance to give some patients some do's and don'ts. Avoid excessive consumption of carbohydrates and all that, and the patient does not comply, and tell the patient, do not take this pain reliever more than this period, two tablets 3 times daily for more than 3 days, for 3 days max. And you see patient swallowing this paracetamol like chin and all these things. At a point in time, the patient stops taking it completely. That's taking the correct things, maybe the chondroitin and glucosamine and all that, leading to extension of this condition. Laziness, some people cannot exercise to save their lives. Old age is a risk factor, especially in osteoarthritis. Massaging is a killer of joints. When massaging takes place in the wrong hands, it will destroy that joint. Take, for instance, rheumatoid arthritis leads to inflammation of the synovial membrane, and then one goes and submits his or her leg to these people that do massaging, and then they massage the inflamed membrane, making it more inflamed, and the person pays the person for damaging the knee and says, thank you, I'll come back next week. That's exactly what's going on. So massaging is contraindicated in many types of arthritis. In most types of arthritis, you can only deliver yourself to someone that is like a neurophysiotherapist that has a clear picture of what's going on in there and knows where to massage and where not to. I spoke about this extensively when I talked about sciatica, which can be watched in Dr. Jung's YouTube channel. Fake medication, of course, that is self-explanatory. Wrong medication, someone is having osteoarthritis and is taking medication for rheumatoid arthritis, nothing will happen. But imagine someone that is having gouty arthritis, taking medication or supplements or natural pharmaceuticals for osteoarthritis. It may just help a little, but it will not address the matter on ground. Poverty is due to inability to work, and then other health conditions like diabetes, which is a disease of diseases. Work-related or social obligations, some people will not rest. They must show that they are everywhere. They are around the whole church, they are around the whole market, they are everywhere. They can't go and sit down in one place. When they know that they are having osteoarthritis, it can exacerbate the condition. Old habits die hard, like smoking. Some ladies that have sweet tooth, they are crying and eating the pizza and the Cold Stone ice cream and everything, and because they know they can't help themselves and know that this is going to increase their weight and worsen osteoarthritis and destroy collagen fibers. That is unfortunate. That has to be addressed. Eating junk food in excess. Some people cannot do without eating meat, and you know that they're having gouty arthritis. Alcoholism too. People are living inside the bottle of alcohol, and you know they have gouty arthritis. Eating Sebastian is also a problem. Seafood and excess carbohydrate, and so on and so forth. Now, poor healthcare and infrastructure. Of course, without these, we cannot even have access to medical treatment and all that. Self-medication, sabinus. So people will look at themselves and say, this my leg is osteoarthritis. How do you know? Do you have X-ray vision? Go to the hospital or go and find a seasoned health practitioner to do that for you. Lack of specialized health practitioners. People are leaving the country. Nigeria currently is one of the highest exporters of health practitioners. Looking to your left, your colleague on your left, you see him on Monday, you will find him on Wednesday. The one on your right is not there on Friday. And then even your boss in the hospital is not even around, and she call you with a foreign number. She has jackpot or travel. That's another problem. Economic challenges and high cost of treatment. We all know what happened in Nigeria recently, where we had a ridiculous increase in price of medication. Of course, that is not useful. We saw people on the TV crying that they cannot afford to buy inhaler because the price was so terrible, and with some pharmaceutical companies leaving the country, making things even worse. And you can see that that can lead to challenges in the management of arthritis. Now, how do we manage and treat arthritis? So let's pay close attention, because this is where a lot of us have been waiting for. Now, these are based on the type of arthritis and include weight loss. Of course, osteoarthritis and rheumatoid arthritis, we need this. Balanced diet, especially osteoarthritis and gouty arthritis, because we can't be eating foods rich in purines. Then we have to avoid purine foods, as aforementioned. Gouty arthritis, physiotherapy, I prefer a neurophysiotherapist. Then quit smoking, as in rheumatoid arthritis. Avoid alcoholism, gouty arthritis. Exercise properly. Some people exercise like, I don't know, as if they're trying to commit suicide. Exercise properly and have people that will guide you when you are doing exercise, so you don't damage the joint that was not even damaged in the first place. Imagine someone that is overweight and the person wants to burn fat, and the person is doing squats so frequently. Before you know what's happening, you see some of my patients, they'll tell you that it was when they wanted to go to the gym to go and help themselves to reduce weight, they came up with osteoarthritis. I'm like, yes, because it's a mechanical condition. That is why we have to be careful not to do this. There's a process by which we run weight management. Professional weight management is different from torture and malnutrition. We have chemotherapy, physiotherapy, and assistive devices. Sometimes we need to put a brace there to support that area so that it doesn't give way. And then drink a lot of water. Water hydrates and helps with padding. Avoid sugary foods and eat lots of vegetables, because we know that vegetables are very good for the joint. They contain sulforaphane and other very wonderful antioxidants that are lovely with regards to joint health. Surgery. Now, we have what is called knee replacement surgery. May this never be a portion by the grace of God. It's not a wonderful surgery because it's often unsuccessful. Then we have decompression surgery, that especially for those that are having lumbosacral or lumbar spondylosis, then the sciatic nerve is being squished in between the lumbar vertebrae, and it needs to both be decompressed. Fortunately, you have to sign a form that will mean that says that in case you get paralyzed, because it's also known as a 50-50 surgery, that means the probability of one to being paralyzed after the surgery is about 50%. So you have to agree that in case you get paralyzed, so you can see prevention is really better than cure. Of course, use of appropriate orthodox medication, that's chemicals. We'll talk about that briefly because we don't want to confuse people, and we're not going to talk much about that because every patient is unique, and unlike in case of peptic ulcer disease, where I gave a regimen for the current eradication of peptic ulcer disease, I will not be able to do that here because we don't want to mislead other people. And the use of natural pharmaceuticals to adequately prevent, manage, and or reverse arthritis. So, chemical intervention. That is when we take all these chemicals. Of course, corticosteroid injection, which is notorious for destroying the joints, especially in the knee. I don't know why people keep doing this, but this is one of the worst ideas with regards to solving arthritis. You can, if you have a different opinion, you can send a message to me personally, because I don't know why one would take a corticosteroid or a steroid, knowing that steroids destroy collagen fibers that are found in the knee. So why are you taking it? Because it will give you temporary relief? Foul. It's a very wrong approach, and I suggest that other means of resolving such issues should be employed apart from injecting steroids into the knee. I have a patient that's in the US that's had meniscal detachment and tendonitis after she went for therapy, and they were injecting these things into her knee. And we had to start from the beginning again. Thank God she's okay now. It was terrible. And imagine the people that introduced her to that problem and now were now suggesting surgery. So it was as if they kept her in a nursery trying to grow the problem before she, my goodness. So that's just on the side. Then we have muscle relaxants. Of course, we have the diazepam, citalud, NSAIDs that are responsible for peptic ulcer disease, exacerbation, and all that. Then we have opioid analgesics that lead to a lot of issues like constipation, anticonvulsants, gabapentin, and pregabalin. Please and please do not use these things beyond what your health practitioner told you. There's a way they operate, and when you use them for too long, they can affect other places because GABA is found in not in more than one place. So GABA, yes, it can help to block nerve impulses, but the repercussion we don't want to know. Then we have topical creams, we have epidural injections. Wonder why someone will go and be taking epidural injections regularly. Are you pregnant? Are you delivering? How can you, even a woman that's delivering will not take more than maybe once, especially during when she's in labor, and then somebody is going to submit his back for epidural injection because you feel bad and you feel better because it helps you feel good after the lumbar spondylosis. It's not advisable because the risk is high when you use it often. And then we have steroids, as aforementioned, and antidepressants, because the one challenge with these antidepressants is that if you withdraw them suddenly, it can lead to depression and suicidal tendency, and a whole lot of them. So let's say, common side effects. You can see, of course, NSAIDs, their chief problem is peptic ulcer disease. Then we have DMARDs, what we call disease-modifying agent against rheumatoid arthritis or rheumatoid disease. That's just the acronym for that. And then we have muscle relaxants. Of course, they cause drowsiness. Imagine relaxing your muscle just before you go and drive. What will happen to you? Of course, we talked about corticosteroids already. And weight gain is also a problem because these corticosteroids help in carbohydrate metabolism and leads to weight gain. Hirsutism is where there's excessive hair growth. A lot of issues. Anticonvulsants lead to drowsiness, dizziness, and nausea and vomiting. Opioid analgesics, I mentioned that. Constipation, a lot of other issues. Antidepressants eventually can lead to suicidal thoughts, sexual dysfunction, and more. There are so many. So it's not as if we are not supposed to use them at all, but please use in the way you have been instructed to. And if you feel that you are using it excessively, you're noticing something different in your body, please ask your health practitioner to change it, or you explain to the practitioner that they are feeling something different in your body. Don't just start drinking these chemicals because they wrote it for you. Sometimes they give somebody, you can be given an appointment for 3 months and you are told to be drinking something that is not good for you. If you drink it for that 3 months without contacting your health practitioner, you may have another condition before that 3 months elapses. So wisdom is profitable to direct. Yes, we can prescribe something for you, but you have to apply wisdom. You understand? So I always talk about natural pharmaceuticals because they have less side effects, and when they're used side by side with those chemical drugs, they also help to mitigate the side effect of those chemical drugs. And whatever they give you belongs to you. That's why I like them. Now, they help reduce inflammation at the affected joints, regulate immune function. When we're talking about immune function, we're talking about autoimmune conditions. Then they help to deplete uric acid from the blood. I'll tell you one of them that particularly does that. Replace lost minerals like calcium, provide essential vitamins for bone healing, enhance production of extracellular matrix, that is where the chondrocytes swim, aka swimming pool, and then enhance healing and rejuvenation of bones. We have somatic stem cell stimulants. We talked about that extensively before. Then protect DNA from damage at joints and bones from free radicals and reactive oxidative species. And then rejuvenate and protect the heart, lungs, kidneys, and other organs from damage by rheumatoid arthritis and other autoimmune-related arthritis. They help to dissolve and resolve kidney stones, as aforementioned, fight infection and joints, especially in infectious arthritis. They help in weight management. Very important. Obesity and osteoarthritis are 5 and 6. If you're obese and you're having arthritis, telling yourself, I've reduced from 500 kilograms, I'm now weighing 120, is still not enough. Because you must have to be within the regular or the normal range of BMI, which is 18.5 to 24.9 kilograms per meter square. That is the rule. So that is how it's done. So you can't escape weight management when obesity is coming together with osteoarthritis. Of course, it supplies essential molecules for healthy joints and joint healing and a host of others. Now, what we're going to see now is not compulsory that these things I'm going to show us next are what you must use, but these are what I use for my patients, and I get wonderful results. You understand? I use them for my patient. I've even been a patient of my own self. In fact, I think we have to even still here. This is one of those things here, because I had a very terrible experience when I had some kind of pain in my hips when I ran upstairs in an electronics shop, and I heard a click and I knew that I was in trouble. And this was what I used to help myself. So you see, we're still here in my office, but I think it was even here the other day, yesterday. So we have this called freedom because it contains chondroitin and glucosamine. Remember that the chondrocytes are swimming in an extracellular matrix that require things like this. Methylsulfonyl methane is a wonder molecule and even supplies sulfur that enhances the production of chondroitin and glucosamine. See that? Then it has stabilized aloe vera gel, which is a somatic stem cell stimulant that is a catalyst for healing. Remember, I mentioned that stem cell that is taken under the tongue or swallowed is scientifically rubbish, except there's an explanation. Yes, the stem cell therapy, but it's not that way. The hydrochloric acid will destroy the one that goes into the stomach, as well as the pepsinogen will be activated by the hydrochloric acid to form pepsin and destroy it further. And then the barrier under the tongue is made of cells. I don't know how the cells will swim through cells. I've explained that before, so be careful. Then, of course, we have antioxidants that help to protect the DNA. So they help, basically, that's the ingredients in here, help basically with rapid replenishment of chondrocytes, that's cartilage cells, extracellular matrix, improving padding, the prevention and management of joint diseases, that's what we're talking about, bone formation, somatic stem cell stimulation as a result of the adaptogenic quality of what the aloe vera from Aloe barbadensis miller. Then, of course, we have anthraquinones that act as analgesics, natural ones that do not cause any problem in the system. They have anti-inflammation components like the semanan, and of course, talk about the antioxidants that protect DNA from reactive species and free radicals. Then we see that it soothes and calms irritated tissue. This has a lot to do with sciatica that is secondary to lumbar disc herniation that is secondary to degenerative disc disease or DDT. That's what we're talking about here, amongst others. This contains basically chondroitin, glucosamine, collagen, hyaluronic acid, which is nature's grease. That is just like applying grease to the joints of the car if you go to the mechanic and it changes a ball joint or bearing, you see that it applies grease there so that there will be smooth running of that joint. That is what hyaluronic acid in here contains. Of course, BioCock is there to ensure that there's adequate supply of antioxidants to protect DNA. So it's essential for joint protection and rejuvenation, joint fluidity. Remember, we talked about the greasing ability of hyaluronic acid. It's anti-inflammatory, hence reduces pain, and helps to rebuild damaged and other joint tissue. provide material to maintain the integrity of the joint. Now, it's 5 times more effective than a lot of other things. We know that's one thing that's also very important. Of course, garlic thyme. Now, this is very important for those that have gouty arthritis. I had a patient in Abuja the other day that had gouty arthritis. I gave him this thing together with others, and he went back and checked, and the blood uric acid level had gone down. It was like a miracle. And today, he's still my very close friend. Now, it contains allium sativum and amongst others, and these help to reduce blood uric acid level. Then improve blood flow and circulation, help modulate immune function, have an analgesic effect. Let's bear this in mind. Rather than taking things that will cause peptic ulcer disease, look at natural substances that can help with this. They have analgesic effects, believe it or not, because of the garlic and ginger. Now, it has antioxidant effect that also protects DNA. Remember that DNA is very, very essential because even the cells at the joint have DNA. And if they are not well protected, cells can lose their integrity, further damaging worsening the integrity or worsening the already damaged joint. It's a result of poor protection of DNA. This product is very, very unique. Now, bear in mind that I'm talking about the ingredients that they contain. So if you have any other product that contains these ingredients and you are sure of the source, well, you can go ahead, but this is what I use for my patients. Now, this product contains 1,2,5-dihydrocholecalciferol, zinc, matic, and shiitic, amongst others, and has immunoregulatory effects. If you remember, we talked about rheumatoid arthritis and systemic lupus erythematosus as being autoimmune in nature. And of course, it has anti-inflammatory and analgesic effects, counters pro-inflammatory cytokines in rheumatoid arthritis. I talk about interleukin-6 and other things I don't want to bore us with. Then counter free radicals and retinal disease species that damage DNA. Bear this in mind. And improve production of what? Collagen, that is often abundant here in the paddings of the joint. So let's take, and amongst others, let's bear that in mind. We all know what calcium, how important calcium is. Because we know that. But the challenge is having that calcium that will stay longer in the blood and have better bioavailability, or that's better absorbed in the system. We're talking about dicalcium mannate. It's a noble molecule. This molecule stays longer in the blood and it is easier absorbed. That's why it is better, because the affected joints will have a longer opportunity to absorb this calcium and repair itself. That's why it's important. We talked about the importance of copper yesterday, especially in the joint when we're talking about sciatica and how it is very important in regards to degenerative disc disease or lumbar disc herniation or lumbar spondylosis, actually. Then, of course, you see that it contains 1,2,5-dihydrocholecalciferol, and it also contains vitamin K2, which is essential to remove calcium from the blood and from the flesh back to the bones. Some people take calcium all the time, forgetting that calcium is also indicated in formation of atherosclerotic plaque that can lead to heart attack and stroke. So you have to be careful. Although our bodies, by the grace of God, has ways it helps to regulate these things, but let's not predispose ourselves to issues. So we need to take these things in conjunction with other biomolecules that will ensure that the calcium arrives at its destination and is not deposited in other places and begins to cause problems. So basically, they are essential for, the ingredients are essential for production and protection of healthy bones, especially joints. And as a bonus, it's good for development and maintenance of healthy teeth. Now, Arctic Sea contains eicosapentaenoic acid and docosahexaenoic acid, EP and DHA. Hence, they have anti-inflammatory and antioxidant qualities that helps against pain and joint damage. As a bonus, it helps against heart diseases. Remember, we talked about rheumatoid arthritis causing problem in the heart as a result of rheumatoid heart disease. It prevents cholesterol from depositing in blood vessels as a result of high blood cholesterol, and also that helps to improve blood circulation around the joints. And remember that we're talking about that these cartilage don't even have blood vessels supplying them. So imagine that the blood vessels that are even supplying around where they extract these things they need is even getting blocked. That can worsen the situation. So this will help to open these blood vessels and allow for better perfusion. Active HA, of course, is what I'll call the grease, nature's grease in the joints, as aforementioned. Now, hyaluronic acid is a protein that our bodies produce to lubricate and cushion our joints. How wonderful is that? And muscles, as well as to ensure adequate skin hydration. You find it in skincare products. Remember, as a bonus for women that are actually tackling osteoarthritis, you find out that as they are taking care of the osteoarthritis and other kinds of arthritis, their skin begins to get fresher. It's because of the things that are required to help to take care of the osteoarthritis are also required for healthy skin. So you can see that it's using one stone to kill two birds, and that is also very essential. Nature meat contains phosphorus, zinc, manganese, copper again, as well as iron and all that. And you know the importance of this with regards to bone formation and more. Magnesium helps to relax muscles against spasms, especially those that happen in the waist or around the waist area as a result of DDD and other degenerative issues in that area. Phosphorus is essential for bone healing and development, amongst others. And then, in cases where people are having sciatica secondary to osteoarthritis of the spine, these cobalamin and folate analogs help what? Regeneration and rejuvenation of the nerves. And guess who is a nerve? Sciatic nerve is a nerve. So you can see how important it is in regards to this topic. Of course, I talked about massaging. Please and please be careful when you massage. Just apply. This aloe heat lotion is applied, I suggest it's applied during the day because it's quite hot, so that in the night it will not obstruct sleep. And it's often better when you alternate with methylsulfonamethane. Methylsulfonamethane, we mentioned as a wonder molecule, is also available as a cream. And you can see it's in an adaptogenic base. No need to massage. You cannot massage beyond what it will go in there by itself. Just apply it. Be gentle with yourself. Pity yourself. You're having inflammation already and you're using a tractor or a bulldozer to massage that area. How about just apply and leave it to go in there and do the job. That's how. This is it over here. This is it. I have it here. This is what I used when I had my own issue, recently. And I'm okay. I don't have problem. I did not massage. I did not go to anybody to massage me and pay the person 5,000 naira to destroy my back. No. Be careful. Only use trained hair practitioners to do things that have to be massaged, but they know what to do. Then, of course, we know that infinite Femin complex, which contains raw collagen. We mentioned over and over again that collagen is abundant in joints. So this is it here. You can see that this is raw collagen. So its use cannot be overemphasized. Announcement. Cartilage have abundance of collagen. So if you are taking care of osteoarthritis and you don't remember collagen, my brother and sister in the Lord, you may not have that relief as fast as possible. So it's very important that we also take note of this. And this product comes with phytoceramides and all that help to boost skin health and firmness from the inside. So you don't have any reason not to use it. And it's very, very important we use a very appropriate brand of collagen, because anybody can say collagen fiber, collagen powder, collagen oil, collagen gas, all that. Just be careful what you purchase so you don't waste your time and money. We've talked about weight management, and of course, you can just quietly go and watch the video on lifestyle modification and weight management and detoxification on YouTube on Dr. Drog's channel and on Dr. Drog's YouTube channel, and that will help to explain all this in better detail. So, but just for the sake of information, weight management is critical in management of joint disease, as overweight increases the wear and tear processes that worsen all these things like spondylosis, sciatica, and other knee issues. Of course, we talked about Garcinia Plus, contains hydroxycitric acid, prevents conversion of carbohydrate to fats. PEM is for thermogenesis. Forever Lean contains chromium trichloride. You see that these things are the active ingredients in there that are working. And of course, it helps to regulate carbohydrate metabolism and helps to reduce weight. Then the Clean 9 program is a 9 days weight loss and detoxification program, as well as detox. Yes, it's a 9 days detoxification and weight loss program that systematically helps with weight loss in a matter of days. It even includes a measuring tape for before and after confirmation. So let's remember that you are what you consume, and there is a constant battle between factors that repair and protect our bodies and those that break it down. So let's be on the winning side. And let's kindly remember not to adjust medication and dosage without the guidance of a trained health practitioner. Sabinus, please consult a health practitioner that is seasoned before you make critical adjustments. So aging is not a disease, but it only needs maintenance. And on this note, I will say thanks for coming and remain blessed. Okay, someone says, good evening, doctor. I have been watching your video on YouTube since yesterday, but I couldn't see a detailed lecture on infertility that talks on its management. Kindly direct on how to get it if available. Okay, there's a video on infertility on YouTube, but you know, infertility has many facets, and it also involves the hormonal aspect, infection aspect, blockage aspect, impotence, and a lot of other things. But you see them scattered all over the YouTube channel. But if you want to know more about this, you can get in touch with me directly, and I can gladly give you a personal lecture on that while we prepare for one day we'll talk about infertility as a topic, and I know that you will be there. Thank you so much, Musa, for this. I really appreciate it. Oh, you really enjoyed my presentation. Thank you so much. I really appreciate that as well. What's the difference between sciatica and arthritis? Well, sciatica is a symptom of osteoarthritis of the spine because the sciatic nerve, the roots come out of the sides of the lower spine, the region called the lumbar region. And when they become squished, they lead to what? Sciatica, which is the symptom people feel like numbness and tingling and all that. So that is it. So you can see the relationship between them. That's a very lovely question from Olufemi. That's wonderful. Kende, all right, all the supplements will cost how much totally? No, you don't need all the supplements. You see, these are just talking about the ingredients in this supplement. That means different people vary. So we need to have your history, and no, you may not even need any supplement. You may just need to reduce weight in some instances, because if the margin between the upper and lower bone, in quotes, in the knee is still, adequate. You may not even need anything much. You just need to reduce weight and eat right. But sometimes people need a lot of these things because the damage is extensive. So different folks, different strokes for different folks. Thank you. That's a wonderful question, Kenny. I really appreciate it. Oh, Chibu Goma says, thank you so much, Dr. Drugs. Awesome presentation. I really appreciate it. I thank you for your thanks. Thank you so much for that. Then we have thank you so much from Mildred. Thank you. Beautiful presentation from Delma. Thank you. Then Shili says, awesome presentation, Doc. Always blessed. Thank you so much, Shili. I really appreciate that. Then we have Oyekachi Francis. Doc, thank you so much. I said yesterday, this one concerned me. Okay, don't worry. You can call me afterwards. But I think the best thing for us is to begin consultations from tomorrow because of the, had seminars back to back. So tomorrow we'll start consultations. A lot of people, about heading 200 are waiting. So we'll just start, and before the end of the day, we'll attend to everybody. So if it gets to your turn, kindly be prepared so we can do that. Then please, can you help talk on hormonal imbalance? Yes, hormonal imbalance is a very awesome topic. Now, there's a natural hormonal imbalance. That's natural. I said that because it happens as a result of dropping estrogen and other female sex hormones, and that happens during menopause. So if you can watch the seminar on menopause, you have a better idea what hormonal imbalance can do. But we have all types of hormonal imbalance and how they affect, especially in terms of infertility. For instance, we have hyperprolactinemia that leads to sometimes breast discharge. Sometimes people take things like that bromocriptine and all that to help to relieve that. Of course, then we have hormonal imbalance that is secondary to overweight because, fat cells convert androstenedione to estrone that affects the part of the brain that regulates female sexual reproductive function. You can see there are a lot of things. Hormonal imbalance can lead to hypogonadism, you understand, where the reproductive organs are not even properly formed in the first place and all that. So it's a wide topic, and I think it will be a beautiful topic for another day. Thank you so much, Lady Queen. I really appreciate that. Yeah. So please, can you share on the damage caused by massaging to the joints? Wonderful. Just bear in mind that oftentimes osteoarthritis is associated with inflammation at the joints, and the blood vessels and the tissue there are tender. Just imagine that someone had something smack you on the back of your hand, and then you bring another thing to smack that same place again in the name of that they're trying to resolve it. It doesn't make any sense. You understand? Because those blood vessels and tissue are tender already. So why do you have to go back to make them even more tender by applying unnecessary force during massaging? For instance, in the case of sciatica, Someone can even massage, and if the sciatic nerve that is in the middle that is coming out of the side of the two bones, it can get snipped and cut off, and then that part that is supplied by that sciatic nerve root just dies. The person becomes paralyzed. I'm telling you, some people will testify that when they finish massaging, they may feel good for that first day, but come and go and ask them how they feel after 3 days. It is worse because it's a waste of time. Just apply and go and follow the rules and regulations involved in the slow and steady repair of these joints, and you'll be fine. Don't hurry. Rush in, rush out. Of course, somebody was telling me I need a quick fix. I know so many medication I can give you that it will be as if you didn't even have arthritis before. But once they wear out, back to square one. So why don't you solve the problem from why before solving it? That's a very lovely one, Obianuju. I really appreciate that. Then we have Onyekachi Francis. Please, how do one get the drugs? Just contact me. Just chat me up on WhatsApp, especially, or whomever or wherever you got this link from. Send the message back, and then these things will be gotten to you ASAP. So thank you, Doc, by Lady Queen, for your help and lesson. I really appreciate you too. Thanks to from Salaudin. Then we have Kimo, that's Toho Bolo. Thank you so much too. Thank you. Yes, we have from Miracle. We have from Edward. Mildred is here again. Oh, thank you. Great job too. No, thank you so much. So what's the name of your YouTube channel? Oh, that's Dr. Drugs. That's it on the screen there. Dr. Drugs YouTube channel. So you can actually just remember to subscribe as well. And then Lady Queen, how can it be treated? Thanks so much, Doc. God bless you. I believe we're talking about hormonal imbalance. You see, different strokes for different folks. So we have to know your history. Of course, test results have to be conducted. That's why you see a lot of people get scammed on the internet, because all they do is, how much? They say 50,000. Okay, give me 2 bottles. What are you drinking? You don't even know. The person that's selling it to you has not even asked you any question. You just said, please, I'm having pain in my leg. I have something that can cure it. What is causing the pain? The person doesn't even know. So we need to always take our time to give enough detail of the situation so that the solution will come up and be more permanent and effective. So on this note, I really appreciate everybody that has been patient with us. And remember to go and subscribe and share the videos on the Dr. Drugs YouTube channel and other social media handles. Let us help people to get well, and let's help save lives. I remember my humble self Lucky, and I'll say thank you for coming. Good night. Bye.